Hardin County, 95 confirmed cases, 3 deaths. Jasper County, 19 confirmed cases, 1 death. Jefferson County, 275 cases, 18 deaths. Tyler County, 6 confirmed cases. Orange County, 70 confirmed cases, 1 death. Newton County, 2 confirmed cases, all deaths related to COVID-19, according to the Buena Beacon. I do not have COVID-19, nor does anyone in my family. However, I do have 2 sisters who have just had the most beautiful baby girls in the world. And yes, I could be a little biased on that one. My point is that my family, other than my sisters and their husbands, have yet to hold these babies. We have yet to see those big, beautiful blue eyes that Austin loves to flash to the camera, or that one chubby fat roll that Hazley has, because we don't want to take the chance and expose these babies. Today we will take a look at the novel coronavirus, also known as COVID-19, discuss the signs and symptoms, and how slowing the spread will help us return back to our normal everyday lives. It is important to know the signs and symptoms of this virus. According to Texas Department of State and Health and Human Services, symptoms include fever, cough, and shortness of breath. These symptoms may appear 2 to 14 days after exposure to the virus, and people who do present with these symptoms should phone their healthcare provider. I say phone because it is important that you and your healthcare provider discuss your signs and symptoms, and they take necessary precautions if you need to come in and be seen by medical personnel. Now that we know the signs and symptoms, we need to know how to spread. This virus is thought to spread from person to person. This means by people who are in close contact with one another, and by respiratory droplets produced when an infected person coughs or sneezes. These droplets can lead in the mouths or noses of people who all are nearby, or possibly being held into the lungs of those nearby. More pertinent information about COVID-19 is how it is prevented. It is important to know the appropriate way to prevent this spread if we want to see a descent in the numbers of positive cases of COVID-19. There is no vaccine to prevent this virus. The best way to prevent infection is to take steps to avoid exposure to this virus, and these steps are extremely similar to those that we take every year to avoid the common flu. Wash your hands. Every 20 minutes for 20 seconds, we should be washing our hands with soap and warm water. If, for some reason, soap and warm water is not available, it is acceptable to substitute with a hand sanitizer product that contains at least 60% of alcohol. Avoid touching your face, your mouths, and your eyes. Avoid close contact with people. Stay home. If you need to go out for the essentials, practice your distancing. Practice social distancing. Now, whenever I say stay home, mental health is considered essential. We are allowed to go for walks down the road. We are allowed to go to the pond or the lake and fish. We are allowed to go for a stroll in the park. However, we cannot use jungle gym equipment or benches. Now, when we are in public, practice your distancing. Keep 6 feet between you and the general public. Wear a cloth face mask, with the exception of children the age 2 and under. It is suggested and strongly encouraged that for these children and our elderly to stay home as much as they possibly can. Cover your nose and your mouths with the mask when you are out. Now, you should never use a face mask that is meant for healthcare workers. Healthcare workers are on the front lines every day, and they need the appropriate personal protective equipment necessary for them to avoid this virus. Cover your coughs and your sneezes. If you are at home, even when you're in public, if you cough and you sneeze, never use your hand. You should use a tissue and discard that tissue immediately. If tissues are not available, it is suggested that we use the crease of our elbow. We don't want to use our hands because if we're in public and I cough into my hand and I use this shopping cart, later on Janice comes behind me and grabs that same shopping cart and goes to pick up some chicken nuggets from the freezer section for her children. Susan comes behind and also wants some chicken nuggets, and she now has touched that same freezer handle. That is 3 people who have my germs. Me, Janice, and Susan. Cleanse, 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 disinfect, disinfect, disinfect. It is important that every day we are wiping down our countertops, our fridge handles, the microwave handle, the doorknobs, and using appropriate disinfectants. Not just a wet wash rag. You should be using Lysol or bleach water. This is only going to end if we do these steps properly. Governor Abbott plans to start reopening the state by allowing malls, restaurants, and retail to open this Friday at 25% capacity. Let's put a stop to this virus so we can all go back to our daily lives, so we can get back in the gym, so we can go get our mani-pedis, so we can sit down at a nice restaurant with our family members that we haven't seen in weeks. This is where we come in. I'm asking you, as my peers, to stay home unless you have to go out for the essentials. Only leave for essentials. When you do go out, use your mask. Make sure that you are following the CDC guidelines and the local guidelines that your authorities have put into place. Now that you know how to prevent the spread, put those strategies into play so we can not only save our community, but our state and hopefully our society as a whole planet.